Good morning, everyone. It's Thursday, April 16th. I'm Stephanie Haney here for 3 News. I have your latest updates on the headlines topping WKYC.com and our WKYC app. Many of those, of course, related to the COVID-19 coronavirus here in Ohio. Each day, we do start off by giving you the latest numbers out from the Ohio Department of Health as of yesterday at 2 p.m. So to start you off with those numbers, our confirmed number of positive coronavirus cases here in the state of Ohio is now 7,791. And the number of deaths is now 361. That's based on an expanded definition from the CDC, including deaths that are probably due to COVID-19 coronavirus and not necessarily resulting after a confirmed positive test of COVID-19. We currently have 2,237 people hospitalized here in the state of Ohio, and 677 of those people hospitalized are in the intensive care unit. The age range has remained the same for quite some time now, ranging from less than 1 year old all the way up to 101 years old, with the median age of people testing positive currently still at 54, and the split relatively even between males and females. 48% of those positive cases are males, 52% identifying as female. Now we'll jump into some of the other headlines related to unemployment, something at the top of everyone's mind, as many Americans received stimulus checks yesterday under the U.S. CARES Act, but many Americans also did not receive stimulus checks under the U.S. CARES Act, and the government still struggles to get provisions in place for those small business loans to reach the people that they need to reach to, and also for that additional $600 per week for people who are eligible for unemployment benefits. Now, here in the state of Ohio, unemployment claims hit 855,000, according to the latest numbers. Now, if you're breaking that down per positive COVID-19 confirmed cases, for every one positive confirmed COVID-19 case, that is 110 people filing for unemployment benefits here in the state of Ohio. Now, keep in mind, the number of confirmed positive COVID-19 coronavirus cases only reflects the number of tests that have been given. In many instances, if the treatment will not change, a test is not being given, even though people are being told that they presumptively have COVID-19 coronavirus. But because we do not have wide-scale testing, we don't have accurate numbers on how many cases of COVID-19 coronavirus there are in the state of Ohio. So keep that in mind. Over the past 4 weeks, though, 855,000 Ohioans have filed for unemployment. That is a hard fact that we do know for sure. Last week alone, 158,678 Ohioans applied for unemployment. Now, to give you a little bit of perspective on this, over the last 2 years, 2 whole years, only 715,000 people in the state of Ohio applied and received unemployment. State officials say more than $227 million has been paid out to over 271,000 Ohioans over the past several weeks, but that is only a fraction of the 855,000 people who have applied for unemployment benefits. That's right around a quarter of the people actually receiving payments, and that's amounting to $227 million. Now, keep in mind, with the system being so inundated at this time, you might have difficulties getting through, but don't give up. Government is saying to continue to apply at unemploymenthelp.ohio.gov to get those benefits. They will be retroactive to the point at which you were able to get, they will be retroactive benefits, so you can make sure that you will be getting everything that you need. They know that the system is inundated, so you should be able to get the help you need. That's what the government is saying. So be vigilant, keep applying. Related to businesses that have been closed, which is why people are in this situation where they need to file for unemployment benefits, there have been businesses that have been deemed non-essential that are being investigated. Specifically in Cuyahoga County, 3 News investigative reporter Rachel Polanski took a look at what's going on and found that beauty supply stores, pet groomers, and smoke shops are among 72 non-essential businesses that have been warned by Cuyahoga County. So our investigative team got a hold of every single complaint filed with the Cuyahoga County Board of Health regarding non-essential businesses that are still up and running. That was a total of 1,100 complaints, by the way, filed so far. and 900 complaints came in regarding businesses not following orders. So 1,100 regarding businesses that are non-essential being open, 900 regarding businesses that are not following the orders of physical distancing and the guidelines put in place, and then 240 complaints specifically related to not keeping that physical distance of 6 feet within there. 600 of those complaints in total were sent to staff for follow-up, and 72 of those stores and businesses were found to be out of compliance with the order. And we told you what the majority of those were: beauty supply stores, dog grooming, retail furniture stores, and smoke and vape shops. There was only one business, Second City Consignment Home Furnishings in Parma Heights, that was closed via a temporary restraining order as being considered a non-essential business. As for other businesses, some of them closed voluntarily, like Beauty Exchange in Maple Heights, because Cuyahoga County, our investigative team specifically traveled to 20 sites and found that many of them were closed of the 72 that had been warned by the Cuyahoga County Board of Health. Now, we understand this is a very difficult time, and that's what the manager at Beauty Exchange said. He said that they didn't lay off employees because they're not open. Their sales have been affected and they can't open to the public, and they're not getting the number of sales that they'd be able to get through online and other things. Other businesses found ways to comply with the county's guidelines, like a car wash in North Olmsted. They were told they needed to clean off the kiosk and disinfect between customers. They were able to do that and are now able to remain open. The Cuyahoga County Board of Health said that there have been no fines issued and no lasting implications other than that temporary restraining order closure of that one business related to those 72 businesses that were found to be in non-compliance. Speaking of physical distancing, the Trump administration will plan to release new guidelines related to physical distancing, including recommendations for regions with low impact of COVID-19 coronavirus to ease up on those protocols. Under these recommendations, harder hit states and cities would be advised to keep their current guidelines in place. On Wednesday, President Trump made the claim that they will be opening some states much sooner than others. But here's a reminder that the president doesn't actually have that authority. Essential business orders have been put in place by state governors. These are under public health orders, and the president, who did not close the state economies, therefore does not have the authority to open them. That authority rests with the states. Those around the president have cautioned him that reopening the country will not be quick. I think that we are all sort of coming to terms with that at this point in time. Although we do have some good news. COVID-19 appears to be leveling out at university hospitals and the Cleveland Clinic here in Ohio. They say they're appearing to see a plateau in cases and admissions to the intensive care unit. So that's a good news for us here in Northeast Ohio for sure. Dr. Reed Dwight, who is chairman of the Cleveland Clinic Respiratory Institute, said this: "It looks like it's been steady for the last week or so. We have the same number of patients being admitted to the hospitals as well as the ICUs. So we're getting to a point where we're seeing that peak, we're seeing that leveling off. That's in line with what Dr. Amy Acton has been saying in the 2 p.m. daily press conferences with Governor Mike DeWine. Both hospitals, UH and Cleveland Clinic, say that they are set with beds and ventilators. So that is great news here for us in Ohio. But they are not easing up on procedures to fight this illness. So they are staying the course, making sure they continue to take as many precautionary measures as we've been taking since the very beginning, which the experts say are the reason that we are in the position that we are in today here in Ohio and not in some of the more severe positions that some of our neighboring states are in. Just last week, Cleveland Clinic sent doctors, nurses, and medical professionals to New York City to help get their COVID-19 coronavirus situation more under control. They did say that if we do need those professionals, they will be called back here to Ohio to help us out here. One last thing to let you know about, a programming note for you. Tonight we have the Our Kids, Our Tribe special. So this will be a fundraiser to benefit the Boys and Girls Clubs of Northeast Ohio, who have also been impacted during the COVID-19 coronavirus pandemic. So the following Indians players and alumni are scheduled to join in that telethon. That will be that fundraiser. That will be Terry Francona, Sandy Alomar, Kenny Lofton, Carlos Carrasco, Shane Bieber, That will kick off at 6:30 p.m. online with our sports news analyst Ben Axelrod and our sports reporter Nick Camino. That will start online from 6:30 going through 8 o'clock, and it will kick off on TV at 7 p.m. starting in Front Row with Jimmy Donovan, and then going through 8 p.m. with Jimmy Donovan on TV as well. If you'd like to donate to the Our Kids, Our Tribe initiative for the Boys and Girls Club here in Northeast Ohio, you can do that at the link in our website, wkyc.com, and on our WKYC app. That's it for your morning headlines for Thursday, April 16th, 2020. You can catch 3 News Connect at noon. That's with Jay Crawford and senior health correspondent Monica Robbins. You can find that on 3 News, also WKYC.com, our WKYC app, on Facebook, and on YouTube. And I will be back here at 2 p.m. as soon as we get those new numbers from the Ohio Department of Health related to our COVID-19 coronavirus cases here in Ohio. I'm Stephanie Haney, and I'll see you back here in a bit.